Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Vertigo. There is a popular misconception among people about dizziness and vertigo being the same. However, as both symptoms are extremely common, it is the time one knows the exact difference between the two. Dizziness usually means a sensation of impending loss of consciousness. The patient feels lightheaded, as if he or she is going to fall at any moment. Dizziness is usually caused by problems related to blood circulation. Ayurveda terms this condition as sannyasa. Food and drink combined inharmoniously, suppression of the urgings of stools and urine, external injuries, and all acts which lessen the attribute of sattva, giddiness of mind, and excite the vata, lead to the problem. These, penetrating into ducts which are the seat of mind and by which the mind communicates with the senses, increase the attribute of tamas, darkness, and produce loss of consciousness. On the other hand, people suffering from vertigo will feel they either themselves or their immediate surroundings spinning around. They cannot stand upright. This condition is called Brahma in Ayurveda. The vata and the pitta become excited and combine with the attributes of rajas, passion, and result in the abnormal functioning of the balance mechanism situated in the inner part of the ear. If vertigo comes on very suddenly, it is accompanied by nausea and vomiting, and often with profuse sweating. However, if the onset is more gradual, it may be simply described as poor balance. In most cases, the common cause of vertigo is a viral illness of an insignificant nature, which within a few days leads to an onset of giddiness, nausea and sickness. On the other hand, any kind of discharge, perforation of the eardrum, or infection in the middle ear cavity can lead to balance disorders with accompanying vertigo. Apart from this, abnormal heart rhythms, valvular heart disease and low blood pressure can also lead to dizziness, as can anemia and migraine. The common factor in all these conditions is a decrease for oxygen being delivered through the circulation to the brain. By far, cervical spondylosis can lead to giddiness and vertigo. The neck contains two small arteries that run up through the vertebrae to supply blood to the back of the brain or the cerebellum. The cerebellum is essential for maintaining an upright posture and balance. That is the reason why in arthritic conditions of the neck, sufferers often experience vertigo when looking upwards or backwards, over their shoulder. There is a specific condition called Meniere's disease associated with recurrent vertigo, resulting in ringing in the ears and progressive loss of hearing. Attacks last from a few minutes to several hours. Anything that affects the normal structure or function of the brain may lead to vertigo or dizziness. Concussion after a knock on the head can lead to the condition, but so can more serious disorders such as brain tumors. However, there will be other symptoms and signs to indicate that something more central and deep-seated is causing the dizziness or vertigo. When a person is anxious or following an emotional shock, the rapid overbreathing can lead to this condition. Vertigo is also commonly seen in depression, in which case, it is often long-standing and constant. Certain allopathic drugs, such as diuretics, aspirin, chloroquine and some antibiotics, may provoke vertigo. Hence, these drugs should be used with caution. Ayurvedic Remedies. Ayurvedic treatment is generally planned, basing on careful evaluation of the causative factors for vertigo. However, there are certain general remedial measures to bring down the attack. For a home remedy for vertigo, soak 5 grams each of dry amla and coriander seeds in water overnight. Strain in the morning and drink by adding little sugar. Mix powdered roots of vacha, sweet flag, and ashwagandha. Take 1 gram of this with 250 milliliters milk, thrice a day. Take 1 to 2 grams of powdered whole plant of Sankha Pushpi with 100 to 250 milliliters milk twice a day. If the attack is preceded by headache, take powder of sarpagandha in 1 to 2 grams dose, twice a day with 3 grams of triphala powder. Muctabasma and its preparations are very efficacious in treating vertigo. 1 to 2 pills of Sathasi Kalarasa, taken with amla juice and honey, is very beneficial in vertigo. Saraswatharishta or Ashwagandharishta are useful if the patient has nervous breakdown and vertigo. Yajendra Ras, taken in dosage of 120 mg twice daily with milk, is another effective remedy. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination, an Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva Sarado Vardhamanaha. Shatam Hemantan Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.